Good morning, Khamma Ghadi. I am Dr. Minal Mohit, Consultant Endocrinologist, Manipal Hospital, Jaipur. I am also a member of Scientific Committee of the 77th National APICON. I welcome you all to Jaipur. In this scientific program, I was given the topic to talk on pubertal disorders. As we all know, puberty is a time, the most important time in a child's growing life. It's a period of transition when a child grows into adulthood. So the transition of a boy becoming a man and a girl, a small little girl becoming a woman. So that is the phase of puberty. Anything has to happen at the right time. So puberty also has a right timing. The timing in case of girls is 8 years to start with and completion by the year of 13. Similarly, in boys, the starting time for puberty is 9 years and the completion is somewhere around 14 years, that is 1 year delay. So what can go wrong? Can something go wrong in puberty as well? We never anticipate, but it does. So what possibilities can exist? There are two possibilities. Either the thing does not happen on time, that is either it is delayed or it happens early. So if it happens early, we call it precocious puberty. So in case of girls, if a girl starts becoming a woman, that is growing of breast buds, development of axillary hair, pubic hair and the onset of menarche, if that happens somewhere before 8 years, that is termed as precocious puberty in girls. Similarly, if a boy starts developing testicular volume, increasing testicular volume, starts having increased penile length, developing axillary hair, pubic hair, beard and moustache before the year of 9, then we term it as precocity in boys. Incidentally, precocious puberty is more common in girls and is lesser common in boys. And when it happens in girls, there are few more things that can go wrong. So either it is central, true precocity, that is right from brain it is happening, that is a pituitary gland which is producing more of the gonadotropin releasing hormones. In that case, we call it a true precocity, central precocity or a complete precocity. Whereas sometimes it can just be a peripheral precocity. When it is peripheral precocity, we call it pseudo puberty or we call it incomplete precocity. So what it is actually, it can just be the breast development, that is known as thelarche, or it can just be a pubic hair development, that is pubarche. It can be clitoral enlargement causing adrenarche. So it can be something to go wrong with any of the peripheral hormones, which can be either endogenous secreted or it can be even given through some iatrogenic sources like exogenous sex steroid administration. So that is precocity in girls. Similarly, the similar things can be happening in a boy also, that is there can be pituitary tumor disorders causing early pubertal development in boys. So that is happening with precocity. Now what happens if a girl does not start menstruating till the age of 13 years? Or what happens if a boy does not develop beard, moustache or penile enlargement or testicular volume enlargement by the age of 15 years? So that is termed as delayed puberty. Delayed puberty is more common amongst boys, and most common cause of delayed puberty in boys is nothing but a constitutional delay of growth and puberty, that we commonly label as CDGP or constitutional delay in growth and puberty. If you look deep into this, you will find that there exists a family history. The father will give you a history that even I started shaving quite late and I it just went on even during my college days. So I kept on growing during my college also. Similarly, the mother will give a history that I had my menarche somewhere around 15 or maybe even later. So there is a family history of constitutional delay. So that particular child does not really need treatment, but the entire family only needs reassurance. We need to make sure that such children are not given wrong treatment or wrongly treated, but rightly diagnosed, and the family is reassured that the child will grow at the right time. Similarly, the most common cause of delayed puberty in girls, the most missed diagnosis is hypothyroidism. So, a very simple test of testing the TSH, that is thyroid stimulating hormone, if done at the right time, we can prevent a very big complication, that is a short child, a delayed pubertal child, just by treating primary hypothyroidism. But the most important thing that we need to remember while treating delayed puberty in girls is a chromosomal disorder, that is Turner syndrome. So, one karyotyping is mandatory when we are dealing with a girl child especially. Otherwise, the basic tests like just doing one bone age X-ray of the non-dominant hand will tell you whether the bone age is delayed or advanced. Then you can go to the GnRH stimulation testing to find out whether it is gonadotropin dependent pubertal disorder or whether it is gonadotropin independent pubertal disorder. And lastly, you need one MRI brain to find out the sella status. So, we need to have MRI of the sella, pituitary sella, to find out either we are dealing with some mass in the pituitary that can happen and that might need a surgical intervention. So, these are the common causes and the common approaches, but the most important is make sure any child attending your clinic deserves to assess any child attending your clinic deserves that his growth should be assessed and that growth should be plotted. So, we should always plot a growth curve for all our pediatric patients and make sure that they are growing healthy and growing rightly at the right time. Thank you.